Well, thank you, Jeremy, and good morning, everyone. I'm so pleased to see Housing LIN going from strength to strength, largely due to Jeremy. So, I've been asked to talk about the long-term care revolution. I didn't invent that word. It was given to me by my funder, the Technology Strategy Board. And so that's what I am going to concentrate on. And I'm giving the presentation on behalf of my co-researchers. As you can see up there are 4 of us. And what I'm going to do is I'm going to, first of all, give a little bit of background about it, then say something about the main study, the background, the findings, the general ones, and then the focus of this conference, which is extra care, and secondly, dementia, because we covered a whole lot of other things as well. And then I'm going to say something about the case study we did about the Netherlands, and more about that later. So, this presentation is based on the research which we did for the Technology Strategy Board. They've got a very large program called Assisted Living. And as part of this, they've developed an ambitious program. And as I said, it's their wording, not mine, revolutionizing long-term care. And I have to tell you, they have millions and millions of research funding. And our research was part of the scoping for this very big initiative, which has just started. There were 3 parts to the scoping. There was our study, which I'm going to talk about. There was the economic case, which I'm not going to talk about. We had nothing to do with that. And there was the qualitative research by an anthropologist. And again, that is for another time, was not done by us. So the background and what we were asked to do was to analyze a wide range of traditional and cutting-edge initiatives to promote independence and well-being. Echo what Lord Filkin said, these are the buzzwords at the moment, with a particular focus on the role of housing. And the case we hoped to put, and I think we did, was to allow the Technology Strategy Board to invest in a future program of research and to persuade the Treasury that there would be a need for even greater investment, both in research and in the provision of services. And also, we were asked to consider the changing attitudes to greater investment, but more importantly, we were asked to reflect the views and desires of both younger, and again echoing what Lord Filkin said, you as an audience are part of that, of course, and older generations. And the vision was to be of alternatives to institutional care. Now, I frankly think there is a very strong case for institutional care for all sorts of reasons, but that was not part of our brief. The main report was sent to the TSB December 2012, and the Netherlands one in March 2013. They were both published in September 2013. Jeremy never misses a chance, you see, by Housing LIN. And the TSB published them last Thursday. What is the difference? Well, the ones published by the TSB last week are very, very pretty. Nothing against Housing LIN. They've got lovely pictures, for example, the Netherlands ones of tulips and windmills and so on. But I have to say, it is in very small print. So read the Housing LIN version. But the pictures are really lovely that TSB have chosen. I had nothing to do with them. So what we were asked to do was to look at the literature and policy documents. And as a result of this, we identified the Netherlands as having a similar demographic profile to us. And I have to say, I've done work in the Netherlands, and the great advantage, of course, apart from the academic ones of they're very like us demographically, they've gone through wars, seafaring nation, is they speak English. Wonderful to do research with the Netherlands. But they did, in all fairness, have examples, we thought, from the literature of care provision that we could learn from. So the main study was desk-based research or reports and peer-reviewed articles from the UK and elsewhere, mainly from Europe, but we did cast a glance at the States and various other countries as well. Now, the findings are based on evaluated initiatives, although we did mention some other promising developments. Now, that's a key point, I think, because it's very easy to look at the grey literature and people will come up to you and say, we've got this fantastic scheme, and you look at it, and you really don't know at the end of the pilot or whatever it is it any good or not? So we were very clear that we were only going to look at schemes that had been evaluated. We were asked to consider the timescales of 2012, 2020, and 2050. Now, let me pause here because both the Office for National Statistics and the United Nations go ahead to 2050. I would caution about this. We were asked to do it and we did, but I really think it is almost impossible to think about as far ahead as that. Who knows what's going to happen? An AIDS epidemic can completely do away with a whole generation. There are all kinds of things that may happen. Birth rate, which is now beginning to increase in this country. All sorts of things we just do not know as far ahead as 2050. So I hope that Lord Filkin's Centre will take this into account. And then just to repeat the figures which he has touched on, the census ones, and you of course know all these things, showed that 16.4% of the population, England 65 plus, expected to rise to 20%. United Nations reckoned that those 60 plus, I don't know why they use 60, I have no idea. Most people use pensionable age or 65. Anyway, in their wisdom, they said it was going to rise from 22% in 2009 to 29% in 2050. And the proportions and numbers for very old people, of course, are going to rise even more. So we started by doing the general background, and we set our study in the context of, and I'm not going to elaborate on those, you know all about these, but just to flag up, it is important to think about numbers and proportions of very old people, increased prevalence of long-term conditions, rising expectations. My daughter and my granddaughter's expectations of care are going to be very, very different from mine. More older people in employment, like me. Many, many older people will either want to or will need to work in old age. Numbers in institutions and costs. Very poor care, which we're increasingly having identified both through research and through the media. Financial constraints, large-scale cuts, even more than when we actually did the study, and the complexity of funding. It is horrifically complex. If either you're an individual or you're a group or an organization trying to find funding, it comes from so many different sources. So the findings, the general ones, to start with, the need to put older people at the heart of provision, not just pay lip service. Don't just include the ordinary suspects that you would have on an advisory committee. Really do take the views of older people into account. And we found many, many examples of older people and their carers who have very clear views, and I'm sure this is true of the Alzheimer's Society, very clear views about the type of services they want and need. Just ask them. And central of this is a desire to remain in a home of their own. It may not be literally where they've always lived. It may be a home with their children. I'm involved with the third big study of grandparents, and it's interesting now there's an increase in grandchildren living with grandparents with no intervening parents. And this is very pronounced, actually, in the States. I can go into the reasons if you want to later. But there are different ways of living. And part of this growth is individual budgets and the importance of role of staff in supporting people who do have these sorts of budgets, more of that later, and the need for adequate resources. The second general finding is the reality of people remaining in a home of their own. We've got to be realistic about this. And what we did in the study, we revisited what we did for the Royal Commission on Long-Term Care, where we produced 6 vignettes. We didn't just invent them. We took them from large studies of older people, and we did kind of 6 classic cases of older people, and then we worked out exactly what services they needed and what costs would be involved. And we've done the sums for that. The third general finding is the importance of key role of housing and the built environment. Now, Lord Filkin stressed, as I have always throughout my career, the importance of housing, but we're now more and more thinking about wider issues of the built environment. Now, I was involved, I was the co-author of the study which was done for the WHO on age-friendly cities in London, which may be revisited. I'm now part of a large cross-research council project called Mobility, Mood and Place, which is actually looking in a number of ways at the influence of place on people's well-being and so on. We're looking at the West Lothian cohort, reanalyzing that. We are looking at neuroimaging, very trendy, older people walking around with devices on their heads to look at how they react to environments. And we're also working with architectural students who in turn are working with older people to design age-friendly environments. So it's got a whole lot of different important factors in that. From the main study, again, general findings, we document, and it's done in quite a long way, of the success of things like home sharing, which is often when an older person provides a home at low or no cost to another person in return for an assigned amount of help. I chaired the Design Council Advisory Committee, in which one scheme in a couple of London boroughs, older people do this for interns. You can't be an intern in London unless you're for a middle-class family or you've got some other way of access to income. And this is a scheme whereby older people will offer to share their home for no or very little rent to an intern. Co-housing, which has been in existence for a long time in both the Netherlands and in Scandinavia, is where people, it started for younger people, but it's now for people mainly over the age of 50, where they live together in old age, cooperatively, so that's another one. But as Lord Filkin has said, and as Jeremy has said endlessly, most older people live in a home of their own, 90% in this country, not specialised housing. So we point to the importance of the research which is done on lifetime housing, and we give evidence about how housing can have a preventive role. Of key importance, and we can't say this more often, is the importance of home modifications. Research shows they're cost effective. Sadly, care and repair schemes across the country are being cut at the moment. I think it is absolutely tragic. Value of technology, enormous potential, especially for health, but we warn about the hype. For example, the findings of the department's randomized controlled study, the Whole Systems Demonstrator, have caused controversy. The Department of Health, I think very ill-advisedly, produced some headline findings in advance of the true peer-reviewed articles which have now appeared in BMJ, Lancet and so on. All I would say is there's need for caution about these particular findings. And also, in a general point, not to do with the WSD, ethical issues to do with surveillance, particularly if you can't give permission if you've got dementia. The value of technology, I think, for the next generation of older people who'll be much more used to sophisticated technology than my generation. But again, we point to previous research, which both I and other people have done, about simple gadgets for the kitchen, kettles that turn themselves off, and the greater use of mobile phones. I think one of the greatest things in the future will be mobile phones, so that you can ring instantly your relative or whatever. I think mobile phones are one of the greatest inventions. Then The next general finding is the move away from public funding for personal services across Europe towards mixed models of care. As has been hinted by Lord Filkin, we are not going to see continuation of large-scale state funding. It is going to be about a mixed economy of welfare, and therefore we need to have advice about providers. There is potential for abuse, and there are problems of regulating providers. How if I've got a personal budget? Do I actually choose somebody to come in and clean my house? Do I take up references? How do I know they're genuine? How do I know about insurance and so on? There are a lot of problems. So the next thing I'm going to turn to very briefly are the two focuses of this conference. Extra care. What did we find about extra care? We found that it was very valuable in the research, particularly for frail older people, but some schemes are outdated, and I and the colleagues have done research on remodelling of how sheltered housing and residential care homes can very successfully be remodelled to extra care housing. And it's generally thought, and this was good news for us, that the UK leads the way, and we did find that. We think that this is a message that can be sent out to the rest of the world. We are very good at this. And the recent evaluations by Anne Netton and colleagues were very positive about extra care housing, but of course less than 10% of people do live in this. And it may not be economic for all schemes to continue as they have in the past, for example, to have a range of communal facilities. And on dementia, we did find the value of extra care housing and technology. I'll come back to that on the Netherlands. So the main study, the findings, the conclusions were, we are going to look for leaders, and I do think public health there's immense potential there, both at a national and a local level. We've got new people coming onto the scene. We concluded there was still age discrimination, particularly in employment, not so much in housing. We thought there should be much more of a focus on improving health, particularly falls prevention, and you won't be surprised to hear this, a higher profile for housing and the environment. We thought there should be new providers encouraged, but need to monitor standards. We thought there should be changes in practice, as is being attempted now with dementia. And we were very exercised in the research about the very low status and poor salaries of care workers. Something has to change about that. We need to change attitudes and training. Paying for services and products, it isn't always money. I mean, we give quite a long example of time banks. Young parents with children have often done this. I'll babysit for you, you do that for me, and so on. And it's happening with older people, swapping services. Why not do that? Give more information, measuring the outcomes, need for more research. Use institutional care more creatively for non-residents. So again, there's a caution about that. The role of industry. There is enormous opportunity for providers, particularly in housing and technology. So finally, the case study of the Netherlands. And what we wanted to do was particularly look at the Netherlands to see if there was examples for us that we could learn from. We did an updated search of the literature and policy documents, a week-long visit to the Netherlands by Eloy Rebai. He was my researcher. He's now gone to do a PhD, partly as a result of, I think, what I put him through. I think he did 15 visits in the Netherlands in a week. Anyway, he's now left me and gone to Edinburgh, and I don't blame him, poor man. So he had a pretty desperate time over there, but he found some amazing examples. Now, the Netherlands have been pioneers in the provision of technical innovation, including telehealth and telecare. It was very disappointing, actually, both in the literature and in what he found over there, that although there were many pilot projects, there wasn't widespread use of this technology. But there was an interesting one example I'll give you, extensive use of the internet. The city of Amir has provided a whole range of internet services across the city. They've invested a lot of money in it, but, and here's the qualification, they designed it in conjunction with older people. It wasn't top-down. Smart homes. I remember years ago going to see a demonstration smart home in the Netherlands where you provide an integrated provision of assistive technology, sensors and cameras. But even a couple of years ago, when I went to see the update one, here I was, the visitor, come to see this model, and it took 2 IT specialists to actually get the system working for me. What do you do at home if you don't have an IT specialist on hand? Co-housing, I've already mentioned, mainly for groups of young people. So the Netherlands, we looked at what had happened there. Research does show it does work, but individuals need to be able to cope with the conflicts that often arise in making democratic decisions and negotiating on the basis of equality. There's one now just started for a group of older women in Barnet. There were encouraging schemes to accommodate people with dementia, including the village of Hogwijk. It's so popular now, you actually have to pay to visit it, if you just want to go and see it, where the aim is to replicate a village life with groups of people living together in small homes designed to reflect a particular set of social circumstances. So if you're interested in the arts, you'll go with that little group. Well, I'm not sure about that. What category do I come into? I'm an ex-civil servant. Do I want to live with a group of civil servants? Don't think so. I'm an academic. Don't think so. I'm a clergy widow. I definitely don't think so. So, you know, be a little bit cautious about this. Changes in financial support. Now, here we can learn 2 things, very important things from the Netherlands. Financial compensation to informal carers for their care work is now excluded, as is help with housework. No help with that. Personal budgets, here's the lesson, have ended for new users. Existing ones can still have it to save costs, but abuse. They found abuse. So I think this is a real lesson about personal budgets. So the conclusions were, although the Netherlands is similar to us in demography, there are some differences. I don't know why we've got these differences. Longer healthy life expectancy, they live on average 4 years longer than we do in healthy life. Is it because they drink a lot of milk? Is it because the children, who are the healthiest in the world, cycle, exercise? We just don't know about that. Dutch older people are less likely than the British to live with their children. Good news or bad news? And informal care is lower and formal care higher. So here are the references. Thank you.